we do have with us Rainbow Children's Medicare. Ekta just spoke about it. And we have with us the management. A good set of second quarter numbers. Occupancies have inched up in the quarter, aided by seasonality. We have with us Mr. Ramesh Kancharla, who's the chairman and MD of the company. Thanks a lot, Mr. Kancharla, for joining in. The street likes these margins and the average revenue per bed. Can you tell us what the outlook on the same is? I mean, will these margins sustain? And going forward, what kind of ARPOB can we expect?
Well, thank you very much. See, what we have seen is in the first quarter, we posted good results. In the second quarter, it's been a fantastic results. So what we have seen is children's healthcare. In the last 2 years, we have kind of been a very different business because the children's healthcare has taken a huge hit negatively because COVID is not a major factor for children's hospital business. So therefore, now we're coming back to normal. It's completely what we see is a normalcy. Perhaps the Q2, what has kind of we have witnessed is there is a more pronounced viral infections, which have led to the more admissions into the hospitals, which is why the occupancy has been pretty high all through across the geographies. So we have kind of delivered a kind of a great clinical care, and also that resulted in excellent clinical numbers as well. As we always kind of been saying that with the hub and spoke model, very unique business model of children's healthcare, and also the reputation of Rainbow Children's Hospital. So all these things put together that, we have earlier said, for us to kind of do our pre-Ind AS EBITDA about 25% is something which is achievable consistently with our operating metrics. I think that's what I would stick to. As we move forward, one thing I would certainly say is that, we have come back into the business. All the operating metrics are pretty good. And as we see in future, we're confident that what we are able to deliver in the next 2 quarters, the overall year would go well.
Sure. So I can definitely vouch for the fact that a lot of children are suffering from viral infections. And probably one of the reasons is because, all of them have come back out in the open post-COVID-19. So there is a huge amount of exposure which is taking place as well. But that brings me to the occupancies which you clocked in this quarter, over 60-odd%. Is that a one-off this quarter simply because of the aberration that you've probably seen on account of seasonality? And what would you probably guide for in terms of, say, working occupancies in the next couple of quarters?
See, generally, we have done the business very well. Even in the occupancies, about 55% also. What's important is what the quality of the business we do. So in the current quarter, that we had a lot of seasonality business, which is why even our average occupancy, average revenue per occupied bed is perhaps lower compared to the normal quarters. So question here is that for the quality business versus occupancies. I would always go for the quality of business and not too much focus on the occupancies. Occupancies are important, but at the same time that, the quality of the business, what we do, because it's not just a primary, secondary care children's hospitals, what we are doing. It's
AWS tailors solutions for your business, big or small, from manufacturing to sustainability to healthcare and more. We're the perfect fit for your business. AWS is how.
Multi-specialty hospitals. We do a lot of specialty work. We do including transplants. We do a lot of intensive care work. These are the important drivers of our business. So therefore, the occupancies versus definitely occupancy drives more top line, but the quality of the business comes on comes with the intensive care services and also the specialty services.
Okay. So that is about occupancies and just the outlook there. But I wanted to understand about your Chennai facility. You recently commenced operations there. You expect it to break even by next year. Is that a target? And how has the initial response been here?
No, usually Chennai is the geography where we are pretty bullish about it because the Rainbow established excellent reputation in Chennai city. And our hub hospital, though it's a 3-year-old, is doing extremely well. And in the first month itself, we tracked very good numbers in Chennai new facility. So that itself indicates that, it is probably going to break even fairly soon. Normally, we expect these to break even in about 18 months' time, these spoke hospitals.
All right. That's about the Chennai facility. It was just, it's interesting that you join us on a day where you've completed almost 6 months of listing. And what this also means is that the lock-in for a lot of pre-IPO investors opens. I'm looking at your shareholding, and CDC owns some stake in the company. Just wanted to know whether they are going to sell, or have you had any communication with them, etc. I mean, the lock-in should open or should have opened already, if not in this week.
I think the lock-in is already opened up. I think the short-term capital gains is something is also going to be released very soon in the first week of December. I haven't heard anything from the CDC yet. Anything? They've been with me as for the last 9 years' time, and they've been great partners. I think it's an option to them because, but I haven't heard anything considering our partnerships, whatever has gone on. So I would come to know if they have any plans about selling it.
Okay. So, I just wanted to come back to the business. One of the key trends which we've seen across multi-speciality hospitals is a recovery in the international business. Max, for example, has seen 110% of pre-COVID levels when it comes to international business. Medanta is at 6% versus their peak of 11 to 12% and versus their low of 4%. So there is a recovery which is taking place there. How much is international as a percentage of your total sales, and what is the recovery or guidance that you can provide us there?
The pediatric business is a pretty kind of a city business and also state. And since we do specialties as well, and also the cardiac and other surgeries, we do see some international business. Overall, at the moment, actually, our international business is about 2% of the total revenue. So what we see in future is that as Rainbow builds more and more specialty services across the country, then we probably start tracking more international business. Right now, I think it's probably at 2% of the business. Probably it can go up to about 4 to 5% time in years to come.
Okay. Last question before we let you go. I was looking at your balance sheet, substantial cash in the books, around 450 crore rupees. Any inorganic moves that you're planning? You are planning expansion as well. Anything we can hear about M&A of any sorts?
See, so far that, whatever you've done is pretty organic so far. And what we see is always, we have a definite view about inorganic acquisitions. So, see, there's something which is a pediatric in nature, which is aligned to our philosophy, where we can actually build a scale. Obviously, we would be interested. So far, we haven't actually thought much about anything in specific. Probably in future, we will definitely look into the opportunities of inorganic as well.
Okay. All right. So we're going to leave it on that note. Thanks very much for joining in and speaking with us. So that's Rainbow Medicare. Just want to put it into perspective that, this is one of the IPOs which has actually outperformed since listing. Its issue price was 542. So it's around over 45% in terms of gains from that issue price after listing. So currently sitting at around 800 odd rupees. There's definitely a lot of optimism in the healthcare delivery space, but this one is also in a niche segment.